Welcome to Doctors on Call. I'm Jenna Miller. Chronic pain is associated with reduced quality of life and affects 20% of the population. This includes an increased risk of anxiety and depression. And while your brain interprets pain, interestingly, it can't actually feel it. Every individual perceives pain differently. Some have a low tolerance of pain, while others much higher. And when it comes to the way men and women handle pain, there's a much different outcome. Pain management is our topic tonight on Doctors on Call with our guest, Dr. Belle Razafindrabe.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Belle Razafindrabe earned his medical degree from Université de Madagascar and completed his residency and training in physical medicine and rehabilitation at the Loma Linda University Medical Center in California after spending a year of internal medicine internship at the same institution. Dr. Belle is certified in physical medicine and rehabilitation by the American Board of Physical Medicine and Rehabilitation. He moved to Great Bend in 2005 and is president of Pain, Spine, and Rehab PA. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us again. It's always lovely to see you each year.
It's a pleasure to be here.
Absolutely. Well, let's get started. I'd like to talk a little bit about stem cells and how that is working in the pain management field.
Well, pain management is also including in progressive and new technology as exploding, especially using less invasive and also targeting the source of the problems, the pain, less use of medication and more specific treatment. And when you mention about stem cell, there are some few options that we can use in pain management. Stem cell can be obtained by drawing your own blood and spin those blood, and so we have a concentration of platelets and plasma, and put aside the red cells and other inflammatory stuff. So if we talk about stem cells, one of them is the platelet, which is plasma-rich platelet. If you take about 60 cc of your own blood, we can have about 6 cc milliliters of platelet, which is within a plasma. And that type of platelet, we can use it to inject into a tissue. So platelet will have some growth factors in it, and also some cells that will trigger regenerations. So the growth factor and regenerations, that cell will grow or also promote growth of the local tissues. And so for that reason, it will help regenerate, help healing, and not only help healing, but it reduces the pain. So in that case, this type of platelet-rich plasma works really well. You can also get some those stem cells from the spine, the vertebral body. You can get some sample by piercing into the body of the spine, get some stem cell out of that, or even the fat tissue. But the most common that we use is the blood, using a rich platelet from our own blood. It can be used for various reasons. You know, let's say someone has injured, trauma. Most of common is the, let's say, pain from tendon at the elbow. Those are difficult to treat because of surgery is quite invasive injections, steroid doesn't last long, and therapy helps some, but it takes a while to get good result. Using platelet-rich plasma or PRP, that injection works really well because within a few days you can notice the start of the healing and prevent any recurrence of that pain again and strengthening the tendon. In my experience, that no one has failed the injection, the treatment using stem cell for the elbow, and not only for the elbow, but in the different joints, knees and so on. It helps the local tissue to heal, regenerate, and have the growth factor in it to help them achieve that process. So it's helpful. Even in a disc that is diseased, as 30 years above, we have a change in the disc, and not only change, but the disc is getting dry and also prolapsed, producing bulging and painful, very painful. This platelet-rich plasma can be an option to decrease that pain and also help regenerate some part of that the disc. There is option for disc pain. We can use burn the nerves that feed those discs. This is just the opposite of that. Burning the nerve or deaden the tissue or so on is one aspect of healing, and the PRP is reviving what we have, and it's also helpful. Those are some aspects of use of it. I see that people who have failed multiple modalities, we have someone that has a ribs fracture, lots of pain, the pain spread everywhere from that locations. Then with use of this platelet-rich plasma, amazingly how that sensitivity, that healing occur and ongoing. I've seen some patients that has felt, we call them complex regional pain syndrome, which is very sensitive, painful, and stuff in the area that has some ligament or tendon or muscle problems, healed and well, strong and less painful. So that is one aspect of using stem cell, and it can be affordable. You may assume what the side effect? You use your own tissue, own blood, so very unlikely to create any side effect or allergic reaction to it.
Sure. And I know you brought up an interesting point because I think there's some controversy at what kind of stem cells that are used in the medical field, but this is completely from the patient.
From the patient. You come and you draw blood from your own, and we use that blood, we'll spin that in the centrifuge, and then we'll make it concentrated, rich of your own platelet, and inject to treat area that is painful or injured, broken, for instance, shoulders, rotator cuff that has some tear in it, injection of platelet-rich plasma in those areas actually remodel that area and has less pain, function pretty well.
Absolutely. Let's talk about neck pain and shoulder pain and what you can do for a person.
Yes, it is very tricky because people come to the pain doctors and say, hey, the top of my shoulder is hurting and it's very stiff. And so I'm telling you that the neck and the shoulder are in the same location actually, and sometimes difficult to tell is this from the neck or from the shoulder, especially those people who have repetitive use of the hand and arm. We don't know exactly, but it is important to have some evaluation and assessment. Pain from the neck can be not staying in the neck only, but it could travel all the way to the arm, forearm, and fingers if some of the nerves are pinched. So let's say we have a neck here. Some of this nerve of the neck are pinched. Those can create pain all the way. the same as sciatica in the legs. This is type of radiculopathy of the neck, and it can travel of them. Not all neck pain have that type of symptoms. Some neck pain that related to arthritis only. Arthritis is something that happened to the facet, you call it facet, arthritis of the bone, have pain that is just staying in the neck. But, however, the muscle around it, we call it paraspinal muscles, sympathize with that pain, and that pain referred not only in the neck, but spread toward the shoulder, in the shoulder blades or scapula. And so, not only the neck pain, but it's affect the way you turn the head to the side. And so a patient will say, "Doctor, my shoulder is painful. I cannot lift my shoulder. I cannot rise it. It's so painful." So that's why we need to be there to distinguish, is this really shoulder or neck, And by having some injection or block of the area in the neck that possibly causing it, will loosen up the pain in the shoulders. And then the same way, shoulder pain, maybe local shoulder pain, patient have some problem with it, playing golf, even just a very simple task at home, have some pain, and they feel like it's my neck because the pain is from my shoulder and it travel up to my neck and cause headache. The same, we can treat the shoulder a little bit, and if it relieves the other part, to distinguish that. So
I know every year you're here, there's always something new. So let's talk about the new technology that you have in your office right now for pain management.
As you said, it is pain management is evolving, and the new tools are exploding a lot. As we know that the pain can come from any part of the body. We treat pain from the head to the toes. But most of the pain patients that we see would say 80% related to spine. And so patient will explain where the pain comes from. Let's see if it's pain coming from a pinched nerve. Pinched nerve from this area, for instance. Why is it pinched there? It could be disc that pinches that nerve, and it could be the arthritis in those areas that is pushing on this nerve and causing that sciatica. With a simple tools, as I see here, we have a spacer that we put in between vertebra, right here. For instance, spacer like that will open up the space, and it doesn't take long to insert that to someone that very specific, and that relieve that pressure of that nerve. Let's say it's not the bone that causes the pain. It was the disc that causes the pain. Then we have option of using endoscopy. Endoscopy is a tools like small tools within a tube like this will get through the muscle and get close to the disc. Because it's so deep there, you cannot see it inside, but with a camera, it will display on a big monitor, and so anything inside that spine can be seen live through a big camera. So with that type of option, we can trim the disc, cut one portion at a time, and we can see the nerve, and the safety of that portion can be pretty good, because you have a very big screen that will show what you are doing. So that's an option, endoscopy, that will help reduce the time and the tissue destruction, because if we use a different type of surgery, you have to cut the muscles and open it up and cut the bone beside it to get deep into that disc. So that's another one. We also can mention about people who have fractures of the spine. These are very common, especially in elderly ladies. Sometimes we leave them, if they don't know the option, they have been pain for a while, using tools that very minimally invasive, get into the spine, into the vertebral body, and put a balloon there. The balloon will create cavities, and the cavity is open, and so able to receive a cement that will get into that cavity, relieve the pressure right away, relieve the pain right away, and restore the height of that vertebra. So this is one of that. As you can see, those white area inside the spine is the balloon that restore the height, and we call it kyphoplasty. Some patients who had multiple surgeries or multiple injury that it's become difficult to get access to it because of the scar tissues, and the nerve is tightened up from different structure that we might be not have any much structure, but the bone may be gone and so on. In those cases, the spinal stimulator, like we see here, is an option. We can insert there. It will not change the spine that you have, but it will block the pain from getting into the brain. So it is helpful for last resort type of pain in the patient.
Sure. Now explain that a little bit. We talked about the brain. You say it blocks the pain from going to the brain. Let's talk about how the brain affects all that.
Yes. The pain is processed into the brain, some part of the brain, the thalamus and the cortical aspect of the brain, which is part of the brain, receive the signal of pain and then say, I'm hurting. The skin has some nerve, you touch the skin, you have pain, and it will get into part of the spine and travel from the spine all the way to the brain. And this type of spinal stimulator has a type of leads. Those leads get into the posterior part in the back of the spine where we call it the brake, the brake or the gate. It's this gate is that will close the pain from reaching the brain. And this type of stimulator actually work on that, kind of stimulate that area. And this, by doing this, it will close the gate of the pain from reaching the brain. If it helps 50% of the pain or more, that is very rewarding and worth it. But before we put a permanent one, which has small batteries that may last about 10 years, we need to have a trial, for qualified patient who need it. We give them a trial of 1 week, test it at home, play with it, increase intensity, and there's a different type of mode there. And so if patients feel like, I really like this, it relieves the pain, most of it, some pain in the legs, pain in the feet, pain in the legs and the thigh, then okay, we'll put a permanent stimulator for you. And so on. It's most of the time very helpful.
Very interesting. Now let's talk about, depending on the procedure, because I'm sure it's very individualized between patients, but what type of recovery time are we talking for the different kinds of procedures?
That's a good question. The recovery time with a minimally invasive spine is very quick. Actually, when you have spinal stimulator in place, the patient have about 1 hour and a half of procedure time, and they go home the same day, and patient actually walk out of the door. So when they get home, it's as a procedure, it was a surgery, so patient will come back, see me in 10 days, or remove the suture or so on. So there are some soreness that need ice and so on, but the patient are able to take care of themselves. This procedure called the spacer that we put on patient in the spine, the same. They come to the clinic, it takes about 1 hour and go home the same day. And usually feeling better because the pain that intractable miserable in the legs, so it's gone. Most of the patients say, hey, the pain in my legs and thighs gone. I just have some aches in my back. And those are, we give some pain medicine for patients because of that. Some of them doesn't need it. It takes about, they go home, but they would say, take care of yourself, lifting about 10 pounds or so, limit bending and twisting as much. And once they come to see me in 10 days, I can say, hey, we can allow you to do a little bit more, depend on their occupations. So within a month or so, patient does pretty much everything at home.
Okay, so we talked about neck pain and shoulder pain. Let's go to the lower back. What can you do for a person with a lot of lower back pain?
Oh, lower back pain. Most of the patients with pain actually have pain in the lower back. And as we mentioned, it can be, depends on the structure that affected. Most of the pain that people working hard is the arthritis of the spine in the lower back, the disc issue. And what we mentioned in the past here, that we can do a trial of numbing medicine on each level of those back. And if those are helpful, the patient who were bent over before, we are with those testing right away, they can stand tall. And those medications last about 8 hours. So within 1 or 2 days, then the pain will come back. So at least to have a period of time that we are very confident that the pain was in those arthritis. And so with 2 trials in the same location using numbing medication with satisfaction more than 80%, the patient become candidate for radiofrequency ablation. So the radiofrequency ablation is actually, it's like a burning those small nerves. And if you burn those small nerves will not carry the pain from that area. So that's why the patient is able to function almost right away. Those nerves will grow back, but more than 6 months, average patient that we did those, about 2 years, 3 years of relief. So that's a good thing. That is just for the arthritis. But if a back related to disc pain, then we need to find out which disc is causing the pain. In that case, we need to have a small pin, and we call discogram or discography. We get into each disc, 3 discs, and have injection into the disc. The dye get into the disc, it will spread. If the disc is leaking, we can see that, spread and leaking into the disc. If the disc is painful, the patient will feel it, very painful, and say, oh, that's the pain I usually have. And we can mark that disc that is painful, depends on the location. Then we provide option for treatment, either fusion or pain medication, or using that injection of stem cell. So those are options for disc. If you have patients with back pain and the pain is radiating or traveling below the back to the thigh, to the knees, or below, we need to distinguish them, because some of the hip pain does the same. Or pain from the sacroiliac joint, this is the tailbone, here is the sacrum, and pain from this joint is the largest joint of the body. It can feel like radiculopathy or pain of sciatica. So before we have a real treatment, we need to test if it's really coming from this nerve or coming from this joint, MRI of people, especially older people, can have multiple problems, It may have a disc bulging, it have a facet bulging the bone, and it could be in multiple levels. All the nerves are tight, but one of them could be the reason of the pain. So we need to pinpoint that and say, hey, based on my exam, this patient has pain coming from L5 or S1 or L4, L3. For instance, a simple exam will ask the patient to walk on tiptoes. Hey, able to walk on tiptoes pretty well. That is type of pain that's coming from S1 or L5. And if people say, okay, let's ask this patient to walk on your heels. If cannot walk on your heels, it could be affecting the L5. So few exams will help us to narrow where this problem come from, and then it's narrow like that, we can target the block in the area that we suspected. And if the pain is relieved at that location, then we confirm that that is coming from the spine. The same for the sacroiliac joint, and say, hey, we did some block in this nerve, it's not helpful. We'll do sacroiliac joint block, it's helpful. Then we confirmed it. And before we do some aggressive treatment, we make sure that the hip is good, because sometimes it then mimic the same type of pain, and we need to rule out those other source of pain.
Okay, excellent. Well, thank you so much for joining us again this year, Doctor, on our 20th season of Doctors on Call. It's always a pleasure to have you. Our next Doctors on Call will be discussing treating depression without meds with Doctors Christy and Robert Clark. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.